Today's video is going to take a little bit of a different tack than normal. Instead of focusing on a distinct medical or surgical topic, we're going to go into a very pragmatic discussion of how to be a great intern, specifically focusing on how to have a good workflow to help you get things done and handle everything that comes across your plate. There are, of course, many ways to do this. This is just my recommendation. The most important thing is to have a good system that works for you. So, intern year, if you haven't figured it out by yet, is extremely stressful. It's easy to feel a bit like this, out of control, overwhelmed. Pages are coming in. You have all these vague, ambiguous tasks to do, and you just don't know what to do, how to do it, when to do what. That learning curve can be quite stressful. However, I think if we can step back and really delineate exactly what your role is to take care of, what tasks you have to take care of, that it gets a lot easier to wrap your arms around and kind of helps you relax a little bit and handle things systematically. So, first, when you really think about it, you only have two jobs as an intern. Step one is putting out fires. What does that mean? It's basically wrangling the pager. You're the first line of defense against pages that are coming in from all throughout the hospital related to your patients. Um, and all these little things that come up just need to be taken care of. And the ones that you get you can take care of, you just take care of. Other ones you might have to bump up the chain to someone more senior than you, but you are the first line of defense screening these essentially calls from the rest of the hospital about your patients. This is unfortunately a little bit outside of our control. We don't know what's going to come through. You just have to be able to roll with the punches a little bit. But there are some principles that will help you do so. The other is that there's a few daily tasks for every patient. These are the same tasks. You repeat the same thing every day. And so this is where you really have a lot of leeway to get a good system that ensures that you don't, number one, don't miss anything, but number two, are able to perform these tasks very efficiently, which will free you up with more time to put out those stressful fires or go do other important things with your day, like studying, double scrubbing, getting home on time, etc. All right. So again, fires are just fires. Some are going to be very simple. Can you please renew this Tylenol? Others are going to be train wrecks that take up a ton of your time. Could have things as severe as crashing hypotensive patients that need emergent interventions, etc. The good news is all of these are going to get easier as you gain experience. But regardless, it probably is the most stressful part of intern year. So we're going to talk about a few principles that you should think about when you're getting these pages. And again, we're going to focus on a system that will help you get everything else done so that when these fires do come up, you have maximum bandwidth to handle them. So, putting out fires. Step one, whenever you get a page, the easiest thing to do is just respond to that page right away. Just take care of it. So, however, not always possible. You may be doing something else, you may get multiple pages at once, and so you'll rapidly learn the skill of triaging these pages in terms of importance. However, when you do triage a page, you have to have a system to ensure that you don't forget about any page. Every page is your responsibility as the intern. You need to make sure that they get taken care of. So the easiest way to do this is just have your ever-present patient list. And anytime you get a page about a patient, if you're not going to respond to it right away, just put a little checkbox by that patient and then write the task next to it that you have to follow up on. And just know that anytime you get a free moment, you're always running through your list, looking for boxes that haven't been crossed off yet, and you'll know once you've written it down that you're going to go back and take care of it at a later date. The tempting thing to do is just read the page and put the pager down and do nothing, but I guarantee that you will forget many of those pages if you use that sort of system. So remember, you get a page. Easiest thing, just take care of it. If you can't take care of it right away, it's okay to triage it, but have a system, usually the little checkbox system, to make sure you don't forget to follow up on it. The second key is it's easy to get a very scary page and not know what to do. And it's easy to freeze, it's easy to get overwhelmed. Um, the best advice I have for you is to have very little threshold, especially at the beginning of the year, to run things up the chain. And primarily, what mean by scary things are vital sign changes. So, vital sign abnormalities, or for example, hypotension, systolic blood pressure is less than 90, tachycardia, hypoxia, etc. Things that suggest that your patient might be very ill and might need an emergent intervention. If this is the case, of course, you absolutely need to go see the patient, figure out what's going on, but you also need to be immediately thinking, okay, who am I going to call? Usually a senior resident to help me start dealing with if I need to. The other thing about scary pages is they get a lot less scary if you have a little bit of familiarity with what the common post-op problems are and what the first couple steps might be to working them up and dealing with them. So we do have some other videos on things like post-op hypotension, hypoxia, etc., that you can watch that might help you feel a little bit more prepared. Because I find that that little bit of preparation helps you keep a clear head in those situations and react in a more effective way. All right. So, like we said, there's fires and those are out of our control, but there's also a bunch of daily tasks. And these are where you can really shine, really have a good system that's efficient and helps you do everything else on your day uh, in an effective manner. The better you do your daily tasks, the more time you're going to have to really do what you're at residency to do, right? Which is to learn to become a great doctor. So you'll have time to study, you'll have time to read up on your patients, you'll have time to go operate. Um, Really, once you've done it a few times, the educational value of putting in one more note or one more order is relatively low. So you just need to figure out how can I take care of these quickly and efficiently so I can get to the learning, the crux of residency. So everyone that I know has some sort of system that's something like this. This is my system, and you can adapt it as needed. But these are the basic tasks that I've found need to get done for every patient every day. I use this acronym, I guess, NOSA. I don't really say that as a word, but that's what it would spell out. N stands for note. Each patient needs a daily progress note. O stands for orders. These are usually things that come up on either pre-rounds or morning rounds. When you go see your patients and your senior resident says something like, oh, we're going to start antibiotics on this patient, you would make a little box on your list saying start antibiotics or get a CT scan, something like that. And these are orders that need to be placed in the EMR. Sometimes after rounds, these are usually your responsibility to actually put them in. S stands for sign out, and this really just means updating that list, updating the patient list with anything new that happened over the day. Oftentimes, there's a to do box that needs updating, or if something big happens, like they get an operation or a major procedure, that usually has a column that needs to be updated. And then finally, A stands for morning labs. And even if you don't get morning labs on every patient every day, it's important to just have that in mind that a lot of your patients will need labs, and you want to make sure that those are ordered. Now, this acronym only works, or I should say, it works best when you use it both to remember what needs to be done and to keep track of what you have done. So I will write these four letters vertically next to every patient on my list. And then once I've done, let's say I put in the orders for a patient, I'll cross that orders letter off to know that I've done that. Once I've written the note, I cross off the note because it's so easy to forget. Oh, did I write the note on this patient or that patient? And once you forget, you have to go back, pull up the chart, and recheck, and that can actually take a whole lot of time. So use this acronym, write it by every patient, and once you've done each task, make sure you cross it off, and that will save you a ton of time. Now, just having the acronym isn't enough because in able to do your job most efficiently, there's actually a pretty defined order that you should do each of these tasks in. And the easiest way to remember this is that tasks that need someone else's input that you can't just knock off by yourself are the tasks that you want to get done first because you want to give that other person the most time to get those things rolling so they actually get done for your patient in a timely fashion. Because you can always just sit down and bang out your notes at any time. So, step one, the first thing to do, because it usually takes the team the most time, is calling consults. Um, uh, Keynote to think about here is just make sure you have good paging etiquette. So if you page a consult about something, and you'll be on the other side of this later in your training, make sure you page with the MR number, MRN number, whatever it is, some way for the consultant service to look up that patient so they can start getting data on them and give them a callback number that they can reach you at. Because if you don't do that, those are the most frustrating pages to get, and they're unable to, for example, call you back and actually get the info about the patient, get the results. All it's going to do, paging poorly, is frustrate the consultant and delay the care that your patient needs and delay the amount of time it takes for you to get the tasks that you need done. So, first thing in the morning, obviously, don't be completely mean about this. Wait until the consultant service comes into the hospital, which will frequently be later than you are ready to call consults as a surgery intern. But as soon as you can, call the consult, get that cooking so you can get those results in a timely fashion. The second thing is placing orders. Again, unless you are running around administering medications and running the CT scanner, these things rely on other people to do them. So once you have your list of checkboxes for each patient of things to order or things to cancel, just go through and do those as a top priority because that will get people in the queue to get their scans faster, gets medications administered at the proper times, etc. So the second thing on my priority list is placing orders. And then a distant third. So when you're first getting out of rounds as an intern, absolute first priority is calling consults, placing orders. I'll do this on all my patients on the service first. And only once I've done those things will I look at anything else. And the next step is discharges. Now, as much as the hospital might tell you that this should be your first priority, you must discharge patients early, we need turnover rooms in the hospital. In my perspective, if a patient's discharging, that means they're relatively stable and they don't need that much acute clinical care from you. So, this acute clinical care takes priority over the discharge. Then I'll focus on discharging my patients. And again, I have a system for this. So for me, I do it, call it OBS, because that's how it works at my hospital. You have to do the discharge med reconciliation, push the discharge button, and write a discharge summary for each discharging patient. I wouldn't worry too much about that acronym. Just figure out what needs to be done at your institution and have another system to, when you're going to discharge a patient, ensure that you do each of those steps without forgetting anything. And finally, once you've done all of those things, only then do you turn your attention to things like writing your progress notes, updating your sign out, ordering the morning labs. These are the absolute lowest priority. There's no time sensitivity on them. There's no patients waiting to get meds or scans. There's no services that you need to wait to do these. These can just get banged out anytime you have a free moment at a computer. And so that's why, even if it feels uncomfortable to not have the note done, not do everything for a patient at one time, these are actually best left until the last thing on your list. And once you get used to your system, you know you're not going to forget a progress note on somebody because you haven't crossed off the N next to that patient's name. So it all kind of comes together. While we're talking about notes and documentation, just a brief note or my perspective on it. Um, in my opinion, the purpose of documentation or notes on patients is number one, clinical communication. The hospital would argue probably that number one, or at least number two, is billing. Although this is less important for surgery since most of our billing is global, which means that you don't make money per the progress note that you write for each patient. It's more about the entire hospital stay for that surgery. But regardless, if you keep in mind that the goal of documentation is communication, then this next phrase makes a lot of sense. And brevity is, in my mind, the soul of communication. And this is a case where if you really embrace this, it's a win win for you and a win win for everyone else that reads your note because the less you write, the less time it takes you. But also, then it's just much more clear for the person reading your note what's actually going on, what are the key changes that actually happened today, etc. So, um, especially in a daily progress note, writing these massive paragraphs is not really a useful thing. I want you to practice writing shorter notes, writing notes that really convey your point in the least amount of words possible. That's going to save you time, and anybody who reads your notes is really going to understand what's actually going on in the clinical care. So write only what you need. I prefer bullets over paragraphs when possible. Don't let your notes get bloated. Um, yeah, that's how I feel about progress notes. There's certainly different schools of thought there, but if you're on my service, I will always support you if you write a short, clear note. And that's it. So if we review, there's just two jobs you have as an intern. Number one, put out those fires, man the pager, take care of the tasks, don't drop any tasks, bump things up the chain that need to be bumped up. Um, but you're doing a very important role for your senior residents when you man that pager. And then number two, perform those few daily tasks. Remember our acronym: notes, orders, sign out, and morning labs. If you do that every day for every patient, do them with a good attitude, you will be an absolutely amazing intern that people will love working with. All right, so above and beyond. If you're the type of person that seeks out information on YouTube on how to be a great intern, you probably want to go above and beyond. I want to re-emphasize that what we've already talked about is really the nuts and bolts of being an intern, and that this stuff is stuff that I wouldn't even worry too much about in those first few months when you're really adjusting to the hospital. But as you get your feet under you, get a little more set in the hospital, and want to really turn up your game as an intern, um, really what it comes down to is dotting your I's and crossing your T's on all the little things that can slip through the cracks in medical care. So, especially in surgical patient, home medications is a big one. So, frequently, home medications are held preoperatively and they're only restarted at a certain interval postoperatively. Um, but this takes a good amount of time. You have to click to the home meds, see which meds they're on, which meds have been ordered or haven't, and it just takes a lot of time for your seniors to go through in the morning. So this can easily be missed by the entire team. And if you're an intern, when you have the time, you're going through writing a detailed note. You check into those home meds and bring up with the team the next day on rounds. Hey, is it time to restart X, Y, or Z? You can really stand out and really help your patient's care. Probably the easiest way to do this, and what I did actually for most of these things that we're going to talk about, is I had a little line in my note, for example, that said home meds. And each day in that progress note, I would review which home meds they were on, which home meds they weren't on yet. It just helped me keep track of those. Another thing is stop dates. So instead of just ordering the antibiotics, clarify with your senior how long the antibiotics are needed for. Is this a 4-day course, a week long, etc.? And instead of just ordering the antibiotic indefinitely, order it with that stop date. This ensures that people get the medications for only as long as they need. Have a system for DVT prophylaxis, checking that each patient is on the appropriate mechanical or pharmacological DVT prophylaxis each day. Keep a good track of pain medications. Oftentimes, we order people pretty intense pain regimens right after surgery. And if you're not careful, you can keep your patient on IV Dilaudid their whole 2-week hospital stay. And then you're trying to send them home and you realize you don't actually have good pain control with your oral meds because they've been supplementing with IV and no one's noticed. So, looking at the MAR, seeing what pain meds people have been getting, and then both titrating them down, getting them to orals, and looking for opportunities for multimodal pain control are ways you can stand out as an intern. And then finally, keeping track of the lines, drains, tubes, etc. that your patients have. If they have invasive things like PICC lines, etc., ensure that they only have them for the duration that they need. Again, these are all just little things that can easily be missed by the rest of the team, and that I found that really good interns keep track of and help their patients get better care. All right, so to wrap everything up, by this point in the video, you've got a good idea of the basics of what is expected of you as a surgery intern, or really any type of inpatient intern. So just focus on that. Try not to get too intimidated by all the little things that could happen, all the different things. That's out of your control, and anything that happens to your patient that's really intense is going to get kicked up the chain and managed by people higher up in the hierarchy than you. I want you to kind of try to relax and be reassured that being an excellent intern is not anything that you can't do. It's not about flashy saves. It's not about being brilliant. It's not about heroic gestures. It's really just about coming in each day, having a good attitude, and then doggedly ensuring that all the little mundane tasks that keep the clinical care machine running are just taken care of, are performed every day. Things are not missed. If you do this, you'll get a really good knowledge of how clinical care works. It'll prepare you well for your future years in the medical field. And it will free up your upper level residents too to continue learning and operating, et cetera, with minimal interruptions from things that get missed on the floor. And so when you're a good intern, everybody on the team wins. People will love working with you. And while the task can be hard, it can be stressful, the year is long. Remember, it's just 1 year and you're going to get through it too.